plays out in a lot of different ways, especially as we are trying to recruit people, keep our kids here in Maine. So I do think, just listening to everyone this morning, I think it's important that we pay attention to what's going on, and to the extent that we're able to participate in the conversation and the debates around what can we really do to ensure access but also reduce costs. I just want to, I kind of like to get a sense of who I'm talking with. So small businesses, small employers, great. Larger businesses, over 50. Okay, nonprofits, healthcare sector, widgets. I don't know, it just like tourism or restaurant type stuff, hotel. Okay, great. Well, again, I really appreciate your coming to listen to us today, and I look forward to talking with some of you during the break, and to the extent that we can answer some questions, because I do think what it's going to take to solve some of these problems that we have is that we have to work together, whether we're an employer or representing consumers. We're all in this together, and the current system is just completely unsustainable. So just a little bit about Consumers for Affordable Healthcare. We are a nonprofit. We're located in Augusta, but we provide services, and I'll talk about that in a few minutes, across the state to help people explore their health insurance options, and we actually help people enroll in individual coverage and in Medicaid. We'll talk about that in a few minutes. We've been around for 30 years. We also do a lot of work at the legislature around insurance policy, public benefits, budget issues. I'm trying to think of, a lot of the work that we do does overlap with the speakers who are here today. I see Eric every day in the halls, I see Jeff every day in the halls, and I see Jeff often, or Steve often, but not as often because you're not actually physically located in the state. And it's just sort of an example of why it is important that we're here today, because we do really need to work together to come up with solutions, but sometimes also compromises to address this issue. So you've seen this many different ways. This is kind of a jazzy, hard to read slide, but just to make the point that employers, thank you very much, are covering about 50% of Mainers. The numbers are a little bit different than Eric's, because I think Eric's slides in terms of private coverage were just reflecting fully insured private businesses, or did your slides also represent? Okay, yeah. And I guess the one thing that I just want to comment on, and it's a little bit hard to see, but there's 3 lines from the bottom. And the bottom is just sort of state money that's used to provide healthcare services to people without insurance. But the 2 lines above that, and I don't have a pointer, but they kind of collide toward the end in 2017. And what basically the point is that when cuts were made to our Medicaid program in 2014, about 50,000 people with low income, many of them were working parents, lost coverage. And when that happened, our uninsured rate increased in Maine, because low income people aren't typically offered coverage through their employment, or if they are, their earnings are so low that they can't afford coverage. So there really is a link between public insurance and our uninsured rate. I suspect now that Medicaid expansion is happening in Maine, that we're going to see a decrease in our uninsured rate, which is really important for many reasons. The more people we have in our market, the more likely our market is going to be stabilized. And when I talk about bringing people into the market, I'm talking about younger and healthier people, because the more younger and healthier people you have in the market, the more likely your premiums are going to be reduced. This just talks about the numbers. Nearly 600,000 people in Maine are covered through employment. So our uninsured rate in general is decreasing, but there are some things that we need to be looking at that are a little bit worrisome. And what this slide tries to do is to show that in 3 counties, York, Cumberland, and Androscoggin, Over the last couple of years, the uninsured rate for children has actually increased, meaning there are fewer children insured in those 3 counties. Why should that matter to the chamber? Because children are generally, for the most part, less expensive to insure. They're a healthier group of people, and if you can get them in the market, it will help everybody in terms of their health insurance premiums, which should be lower or reduced as a result of that. When we have healthy people, and this is children, I'm not even talking about young adults who aren't necessarily entering the market, when we have an increase in the number of healthy people not entering the market, it's problematic for us because it means that we have more unhealthy people in the market, and the more unhealthy people you have in the market, the higher your premiums are going to be. So my point here is we need to do more to get young people in the market because it will affect our ability to continue to pay premiums down the road. Marketplace enrollment. So marketplace is for individuals and small businesses. What you have seen in the last couple of years is a decrease in the number of people, a small decrease, but a decrease in the number of people who are enrolling in individual coverage. Some of that decrease could possibly be associated with an improved economy. People are getting more jobs, and in theory are getting, having more access to insurance coverage. I think that is true to some extent, but the data isn't really showing that. And while an employee might be receiving coverage, we'll talk about this a little bit later on, they're finding it more and more difficult to insure family members. Other things have happened in terms of the marketplace across the country. Maine, for example, used to receive about $600,000 from the federal government for navigator services. Those are services that were provided by people across the state to enroll people in coverage. That amount from the federal government has decreased. I believe we're getting about $100,000 now to help people enroll in private coverage. We don't advertise the availability of coverage, and for most of us, probably everybody sitting in this room, what happens when we start a job, on the very first day you fill out paperwork, right? To enroll you in coverage. All you have to do is say what your social security number is, what your sex is, what your address is, and you have a health insurance card. If you do not have coverage through an employer, trying to figure out which coverage is best for you, how you're going to afford it, what's going to pay for your prescription drugs or other ongoing services you need is extremely complicated. Has anyone had to do that in the last couple of years? Has anyone had to find health insurance for themselves? Is it simple? No, it's very, very complicated. And that's something that Consumers for Affordable Healthcare does on a daily basis. And again, I'll talk about that because we could serve as a resource, perhaps, maybe not to your employees, but to family members. So this is no surprise. Reasons for being uninsured among non-elderly adults. At the top of the list is the cost is too high. No surprise there. We did some polling toward the end of last year across the state, and the number one issue identified, again, no surprise by Mainers, was concerns about the inability to pay for services even if they were insured. So co-payments and deductibles and other cost sharings, which is an issue because we talked earlier about the different kinds of health plans that people can buy on the individual market and how some plans have very high deductibles. I think employers are now offering plans to their employees with higher deductibles and more cost sharing. You have, what the research shows is the more cost sharing that you have, the less likely it is that people are going to be able to get the services that they need, whether it be a prescription drug or a diagnostic service. And overall, that will increase costs because if people don't get the treatment that they need to stay healthy, they end up needing more expensive care, whether it be emergency room care or some more serious illness that's not diagnosed early enough to prevent a person from needing more expensive care. Concerns about access. The number one issue that was described to us in our polling was the ability to afford prescription drugs. When you look at common drugs that people have been taking for a long time that have not changed, things like insulin, for example, a life-saving drug that somebody needs on a regular basis, increasing 300% over the last couple of years without any particular explanation. I do think that that is an area that everybody agrees to that we should be able to do something about. However, it is really difficult in the United States to be able to control prescription drug costs. There are some bills in the legislature right now that is trying to point Maine in the right direction in terms of starting to address prescription drug costs, and I think Steve is going to talk about those in a few minutes, so I won't take a lot of time doing that. But I will say I was at the public hearings for those bills, and we had lots of patients coming in, lots of people coming in, lots of provider organizations like the Maine Medical Association and other consumer groups coming in saying we need to do something about this. People are not able, even if they have insurance, to access the prescription drugs they need because, for example, Katie was talking about the person who has a high deductible plan. The deductible was met through the year, and November, December, they were only paying $15 for their drugs. January comes, they have a new deductible. This person had to pay $400. I talk to people who have to pay thousands of dollars for drugs that they need. My point being is these prescription drug bills are receiving bipartisan, unanimous support in the committee, and I would love to have members from the business community there supporting some of these initiatives. They're not initiatives that are going to change drug pricing tomorrow, but they are initiatives that really do have some potential in reducing those prescription drug costs. If we can reduce prescription drug costs, the hope is that our premium costs will go down. So that's part of the reason why I'm really happy to be here today, because I hope down the road we can further engage the business community in some of these initiatives that I do think would make a difference in your bottom line. So, no surprise, employer premiums continue to rise. Employers who were surveyed by the annual healthcare survey, National Business Group on Health, I don't know if that's a group that you're familiar with, no surprise, specialty pharmacy, treatment for specific diseases or conditions such as cancer. These were key drivers in terms of costs. And these issues are important when we start thinking about possible solutions for employers in Maine. What are options that you have to reduce your healthcare costs? Some of them were talked about by Eric, some were talked about Katie, when you start thinking about things like association plans, which look good, and they probably are good in most circumstances, but we do, and self-insurance, we do need to be cognizant about the ability of employers or groups of employers being able to cover their costs, because if something does happen down the road or prices continue to increase, you have to be able to make sure that the plan or the route that you choose is sustainable. And there have been instances, not so much recently, where businesses who were self-insured were not able to meet their claims or the demands of their employees, and they went under as a result. So again, I think it is complicated, but the more that business owners like you can come together and learn about the options and work with policymakers in trying to figure out what might work best, not only in reducing costs, but ensuring that you can cover your employees in a responsible way, the more likely we'll be able to pave the way to a solution. Workers covered by smaller firms, small businesses, I don't need to tell you, they are really struggling. I'm a small business. Our insurance went up around 20% this year. Very unsustainable, no raises for the last 3 years in my small nonprofit that employs about 9 people right now. It's an issue that we need to address as soon as possible so that we can encourage business startups, which is really important in Maine. I think the other thing that's unfortunate that we hear from small businesses about is the inability to provide coverage to family members. And I think that slide that showed that children were becoming uninsured really says a lot. You might be able to afford coverage for yourself or for your employees, but the family, they're on their own in terms of getting coverage. Again, we need to bring those people back into the market in the effort to stabilize. And then over time, what the data is showing is that increases continue to outpace wages and inflation, with employees being responsible for higher deductibles and costs. So why is that a problem for main employers? The fact that more costs are being shifted to your workers, especially these days. Yeah.
So you're saying wagons are important on that number that you just talked about?
Right.
1,600, 1,160? You quote that.
Okay. Yeah. So we just hired a new staff person, and I know that, the workforce in Maine we're all struggling to find good qualified workers. And what I found out in the interview process was that while people are concerned about how much they're getting paid, they're even more concerned about what the health insurance coverage is going to look like. And if you can't offer good quality health insurance coverage along with a decent salary, you're going to have a hard time recruiting people, I was looking at the Maine Association of Nonprofit website yesterday at the jobs that are available to people in Maine. Employers just cannot attract people to come to this state and fill very important jobs that need to be filled. Yep.
Also, in addition to the pressure there, the employee who doesn't have any coverage is more likely to be absent or unproductive, and they're distracted by sickness at home. I mean, the whole syndrome is not positive.
You're absolutely right, and that's what's really frustrating about the prescription drug issue, for example. Somebody has a high deductible, they can't afford something like insulin, for example, or even allergy medicine, or some other chronic disease that they're trying to manage. If they go without that, there's health problems. It's going to make them have to go to a more expensive setting to get the health care they need. But it also means you're going to lose work. And as an employer, trying to meet the needs of whatever your business is, it can become a real nightmare. So I guess the point is we need to work together. It's complicated. There's not one solution. I think Jeff was saying that if somebody has an idea in terms of how to sustain rural healthcare, for example, let him know, let me know. I don't think that's really how it's going to work. I think it's going to take us all working together, whether we represent businesses, consumer interests, healthcare providers, regulators. We really do need to come together and see what the options are, and then be a little bit more willing to explore options. I think it was Jeff who talked about the eye rolling in terms of single payer, kind of moving to more of a shrug. Maybe it's not something we should push aside. I'm not necessarily saying that I or my organization fully supports single payer, because we can see some difficulties with it, but I do think we do need to look at what options are available to us, especially from a business standpoint, because every dollar that you're putting into healthcare is a dollar that's taken from your bottom line. And when we talk about workers needing access to coverage, we're also talking about the employers, because I talk to employers and small businesses every single day, business owners, who are not only worried about their employees, but worried about themselves and their families and the ability to be able to provide coverage. So I hope that we can continue this conversation in terms of what the options are, how can we be a little bit more creative and work together to come up with some solutions.
So, but why can't the system take care of stupid things that happen right now? Insulin is a great example, you brought it up. It's the result of our patent laws. Why do we allow drug companies to make little tiny changes in insulin formulas and lock it out from other companies? That to me is ridiculous.
Absolutely great.
So why can't, somebody has to have a brain to say, look, don't let this happen anymore. change the patent laws. And maybe that's for somebody else, but I get pretty hopped up on this stuff. I wish I could do that with chicken. It'd be great.
No, I appreciate
If
your
I
energy.
might on that one, just real quick, so I'll introduce myself. My name is Mark Winter, and I'm from Senator Collins' office. And Senator Collins just had a hearing on that exact issue,
Oh, sure.
trying to find out why that is allowed, and she's trying to figure out, can we get that changed to stop that? Totally understand why drug companies get the patent. They need to recoup that R&D that they put in there. But the patent is for a limited amount of time, and they shouldn't be able to just lump in a little bit to keep that exclusivity,
Yeah.
for that patent. And the senator is looking at that and trying to figure out a way to maybe change that because it's not fair.
Sure.
And on a federal level, I know Corning is working with Blumenthal, and they're looking at that very issue, product topic. What can be done to make sure that patents isn't manipulated to kind of close out generics from introducing a drug as incremental improvements are made to an innovative product.
And to make it even worse, the FDA's position on stuff like this, whatever it is it can be equal to but not worse. How ridiculous is that?
In terms of a change that
Yeah,
would create.
you can make it the same, but you can't make it worse. How ridiculous.
So that's why your voices are so important in this discussion, because I can get up there, everybody knows what I'm gonna say, but the business community is very powerful. And again, that's why I'm so pleased to be here today, and here's some energy. I don't wanna go over my time, but I did see somebody else's hand up.
Well, with no disrespect to our legislators, at all levels, I think the answer to your broader question is money in politics. That's why these things don't get there.
Sure, yeah.
So let's talk about that during the break. I just wanna,
Well, and you mentioned business